firstly, thank you so much to IPE.global for this opportunity to share our experiences of learning in lockdown. It's great to be here today. And this is actually the second presentation for IPE.global around our British Journal of Midwifery series of articles. So before we start, we'd all like to say hello. So all of the presenters hopefully are visible on screen. So my name's Alison Power. I'm Associate Professor of Learning and Teaching, and I'm also Faculty Lead for Interprofessional Education at the University of Northampton.
Okay, shall I go next?
Yeah.
Hi, I'm Melissa Owens. I'm an Associate Lecturer at the University of Bradford, although this is my last day and I'm about to go to the University of York.
Nicola?
Will I go next, Alison? Yes, certainly. Hi everyone, I'm Nicola McLarnon. I'm Associate Dean for Learning, Teaching and Quality, and also the IPE Strategic Lead at the Glasgow Caledonian University. Good morning everyone.
Hi, good morning. I'm Professor Liz Anderson. I'm at the University of Leicester in the middle of England, where I lead on IPE patient safety and patient involvement.
Hello, hi, I'm Mike. I'm a senior researcher for occupational therapy here at the Zurich University of Applied Sciences, and I'm happy to see all of you here.
I think that might just leave me. So I'm Vicky Park, and I'm an assistant professor who works at Northumbria University, and I lead IPE across the faculty, but I'm also a national board member of CAIPE.
So that's your team for today, and we will be tag teaming throughout this presentations. But before we actually start our presentation, Liz, as co-chair of CAIPE, would just like to talk to you a little bit about CAIPE and our mission and aspirations.
Yes, thank you, Alison. So many of you will have heard of the UK Centre for the Advancement of Interprofessional Education. It's one of the oldest and most established global groups for forwarding interprofessional education and collaborative practice, and is really a think tank made up mostly of higher education academics and many NHS, National Health Service of the United Kingdom practitioners. As a group, we cover England, Scotland, Wales and Ireland. So we are a United Kingdom, and the National Health Service covers all of us, but it's slightly different in our different countries. So as many of you come from countries with variabilities across the patch, we also have that and have to be mindful of working with our different groups. So we are a membership organisation, and I know many of you are members, and we welcome you if you want to be a member. And as I said, most of our members are higher education institutions themselves. So therefore, under that umbrella of a university, many people are members. Or you can be an individual member and a member as a patient or as a student. So we generate, synthesize and translate evidence and work very closely and in forwarding our aim with Interprofessional.global. We'd just like to tell you that recently we have relaunched our strategy, which will run from 2022 to 2027. It's a very exciting time for CAIPE, and we welcome you to go to our website to see what our strategy involves. We will have 4 key priority groups, and they will be on research, more work to translate the evidence, and of course today you are seeing some of the outputs of our research group. Many thanks to all who have led this opportunity for writing together. We've also got a standard setting group, which is really interesting for the United Kingdom because we've never had, as some countries have, agreed frameworks across our professions for how we want to run interprofessional education in the United Kingdom. So in developing standards for the design, management and delivery of IPE, we have a very pivotal opportunity. Our third group is on faculty development, and many of us get together to run workshops to help and encourage universities that are starting out or struggling with their interprofessional education in the UK. But we do also help many people internationally with those workshops. And our final group, and a key group really, is about translating the evidence into practice, of which we work with IPE.global, and we are forever, as many of you are, pushing for a change in the way in which we educate and train our future healthcare practitioners and those that are qualified. So thank you again, Alison, for a moment to talk about CAIPE. And we hope that you will get a flavour of what it's like to work with CAIPE, because I think we're a very collaborative group and try and practice what we preach. So thank you.
Thanks very much, Liz. So that gives you the wider context of the people who are presenting to you here today. But now just to talk to you a little bit more about the context of this series of articles that we're sharing with you. So the CAIPE Research Subgroup has 22 members, and it's a global membership. So from the UK, from England, Scotland and Wales. Mike was in the Philippines, and he's now close to us now in Switzerland, and also colleagues from Qatar and Sri Lanka. So a truly global perspective. Today, it's members from England, Scotland and Switzerland who are going to be presenting. But I'm hoping, and I can see some colleagues who collaborated on the series in the audience, and hopefully they'll be joining in any discussions we have after this presentation. So the presentation will focus on the final 4 articles in the series of 8. So Melissa will give an overview of Article 5, which looked at the impact of COVID on practice-based learning. Then Nicola will consider the impact of COVID on assessment for IPE. Liz will then go on to talk about the impact of patient involvement and service user involvement in IPE. Vicky has the task of summarising all 7 previous articles, which pulls together the series and looks at the lessons learned and, most importantly, future opportunities. And then Mike will reflect on this process we've just been through. So our shared experiences of collaborating on a global scale in developing and having published this series of articles. And then we can hand the floor back over to you and hopefully have a discussion. And we've got some trigger questions to start that discussion. So before we start on Article 5, well, I'll just do a really quick recap of Articles 1 to 4. And you'll see on the screen there's a link to the YouTube recording of our IPE.global presentation a few months back now, quite a few months ago now, I think. So you're more than welcome to revisit that. But just to briefly go through them to sort of give you context for where we're going on today's presentation. You'll see on screen an IPR.global Pearl. And this first article in the series was produced by 16 authors from the research subgroup. And the series of papers explores the impact of COVID-19 on interprofessional education across the globe. And this first paper was obviously a context paper, and it served as an introduction and gave purpose for the series, and then highlighted the content of the forthcoming articles. And then IPR.global converted the key pedagogical, practice and policy implications from that first article and disseminated it internationally across social media platforms. So we were really grateful for that. And that again shows the collaborative ethos of IPE, all things IPE. And the driver really for this series of articles was that as a research group of academics, we felt it was important that the perceptions and attitudes of all stakeholders, so academics, students and service users, was important to find out the impact of the pandemic on experiences. And we thought this was a really unique and rich data source to explore. And obviously it's always about informing the future, making things better. So we found that was really important to us. So then moving on to Article 2, and at this point we all would love to thank Lisa, who's in the room today, who has not only just successfully defended at Viva and is now Dr. Lisa, but she also took time to create these images for us. So we're really grateful because we think they capture and encapsulate what each article is about. So thank you so much, Lisa. So Article 2 reflected on the delivery of IPE during the pandemic, and throughout the series we used case studies as examples of good practice for development, and again taking those lessons forward. And it identified differences in levels of digital competence and confidence, both for students and facilitators, and found that whilst facilitators had the organisational support behind them to help them engage with emergency remote teaching if it was alien to them, students didn't have that luxury, and so they had to work it out on their own, essentially, which did sometimes negatively impact on their ability to engage with IPE. So that was one of the main findings from Article 2. Then going to Article 3, that reflected on the student experience. And case studies in this article suggested that it's really important that students are included in the design process for IPE, because then that helps ensure it's fit for purpose, it's easy to navigate, it's enjoyable, because people need to be motivated to engage. So really important that students are involved in that process. And also it's important that students had equity of opportunity to access online learning. It was fairly easy for us as academics to move to emergency remote teaching with all the organisational structure we had, but we needed to understand that each student had their individual needs, and these needed to be met in order to encourage them and enable them and empower them to engage with IPE in an online environment. And then Article 4 was largely on academics' experiences of IPE, and actually there were reflexive accounts from myself, Melissa and Vicky, who are presenting here today. And we tried to talk about we're all very passionate about IPE, obviously, but the importance of continuing to develop and have IPE throughout the pandemic, because professional programs require IPE to be embedded within curricula, particularly in the UK. So we also spoke about the pros and cons of delivering IPE in that space, and some of the negatives included, again, harping back to previous articles, where difficulties with engaging with the technology, and also less opportunity to co-create with students. But on the positive, emergency remote teaching really helped all of us to engage with technology, and most people became more digitally literate and confident as a result of the pandemic. So that's a summary of the first 4 articles, and now I'll hand over to Melissa, who's going to talk about Article 5.
Hi, thanks, Alison. So Article 5 was based on practice-based learning and the impacts of COVID-19, and the experiences of 5 different organisations and how they moved from previous opportunities of learning in practice to what happened during COVID-19 and afterwards. Now, the World Health Organization actually requires us to produce people who are collaborative practice ready at the point of qualification, and CAIPE supports that with by also recommending in their guidelines a minimum of 1 interprofessional placement during educational programs. But it's not actually just about being ready at the point of qualification. It's about the experience of getting there as well. So it's about how you become that professional, that interprofessional professional as well. Simulation-based education provides our learners, our students, with an opportunity to develop skills in practice and about practice that they perhaps wouldn't have the opportunity to do in every learning environment that they're in the practice setting. So, for example, it gives them the opportunity to learn skills that they perhaps wouldn't have the opportunity to learn or practice very often. It also gives them the opportunity to practice skills that they wouldn't have the opportunity to practice at all. And it also gives them the opportunity to work with patients, service users and clients that they perhaps wouldn't have the opportunity to work with either. Now, certainly in the UK, in nursing, our professional regulatory body has recognised the importance of simulation-based education and allows nursing programs to actually use some of their hours for practice against simulation-based education, although in midwifery they don't, so it actually has to come out of their additional hours, and different programs have different requirements. So this paper then spoke about the experiences of 5 different universities, health education establishments, and how they actually addressed the need for practice-based interprofessional learning during COVID-19, and it shows a range of different of experiences. So from one extreme, it talks about one organisation that actually stopped the simulation-based education opportunities that were being delivered. It talks about others who looked at more creative ways of being able to redesign them. So for example, in one, they developed a pop-out clinic. So they reframed the way that they actually delivered their interprofessional simulation-based education. Others were also extremely innovative, moved online, got their patients, their service users to act as actors online, so that their students were able to have a fully immersive opportunity of still having an interprofessional student experience, despite the fact that we were in the midst of lockdown. And this gave people the opportunity to not just innovate, but also reevaluate what it was that that we were doing, and reconceptualize the way that we enable our students to participate in interprofessional practice-based learning, despite the challenges that COVID gave us. Okay, thank you. And I'm now going to hand over to Nicola.
Thank you very much, Melissa. There we are, thank you. So paper 6 focused on assessment and particularly on the considerations and adaptations made to the assessment of IPE during this really challenging time during the COVID-19 pandemic. Clearly it was a challenge for students and staff alike, but I think it also presented an unprecedented opportunity for us to reimagine and to re-examine how we assess IPE, particularly in an online environment. So the paper discusses assessment and its importance more generally, and it discusses the differentiation between assessment of learning and assessment for learning, where assessment of learning is really about certification and quality assurance, and assessment for learning being very much more about supporting students in their learning and the importance of feedback, both for students and for staff. So the paper explores kind of best practice in relation to assessment of IPE generally. It talks about the importance of constructive alignment between learning outcomes, activities and assessment, and also the importance of not over-assessing students and not overlapping with uni-professional learning outcomes. And also in there is woven through the importance of authentic assessment, and that authentic assessment being really important, whether that's in a face-to-face or an online environment. So the paper explores some of the strategies that faculty used during this time, and it does that through a series of case studies and reflections from staff, academic staff in England, Scotland and Qatar. And some of those modes of assessment and the tools that were used, again, very creative, very innovative, and uses of things such as e-portfolios, an IPE passport, simulation activities like Melissa was referring to, and also online presentations. So the case studies highlight, I suppose, the breadth of creativity and innovation of approach to alternative online assessment during this kind of emergency pivot to online delivery. But it also highlights some of the important considerations in the adoption of e-assessment approaches and the challenges faced by both students and staff, and that primarily related to digital literacy and also digital infrastructure. For staff, it was also coupled with confidence and the skills required to teach in an online environment, And for students, it was very much about motivation, time management and accessibility. And these challenges we kind of seen, I suppose, across the board. They weren't obviously specific just to IPE. However, if you put the challenges to the side and we look at that kind of pivot to online or e-assessment, it really did create lots of opportunities for us to assess IPE in a different way. New opportunities to assess higher order thinking, new opportunities to assess practical skills online, and obviously presented increased flexibility with regards to time of delivery and also geography, and all those kind of inherent challenges that we have faced in terms of logistics of IPE delivery in the past. So that aside, we also need to be cognizant obviously of best practice in assessment and assessment of IPE when using such or online approaches, and we need to be cognizant of the impact of considerations such as digital divide and digital literacy and capacity on educators and students. And now I'll pass over to Liz, who's going to talk you through paper 7.
Thank you, Nicola. And this paper is all about service user carer involvement in interprofessional learning. And for the purposes of a journal of midwifery, in fact, we involved Tracy Coleman, who is a mother herself, who as a result of her experiences of a very difficult and challenging birth, ended up becoming a lifetime carer for a disabled son who's still fairly young. So Tracy is our first author, so working with a service user was really very, very important. But thinking more widely, of course, to IPE generally, over and above involvement within maternal care, we all know that patient involvement, service user involvement and carer involvement in education and in research for healthcare policy and for how we prepare patients is now seen as something very, very important, and there is a global movement for this. And in fact, if we think about it, patient involvement is probably 50 years in its emergence and has a very similar pathway to interprofessional education and having its challenges. But there are still many obstacles for involving marginalised groups and those that are discriminated against, and work for us all to do in this space if it's going to be truly participatory and inclusive and an equal two-way process. And when we wrote this paper, if you go back to the theory underpinning all of this, there is still a dearth of research in theoretical understandings for how we bring in here mothers, service users to help co-create really exciting learning. And yet, reading the story of Tracy in this paper, it's incredibly moving. Whenever I'm with Tracy, I'm always blown away by what happened to her and what continually happens to her, and how we as practitioners need to stay cognizant really of their experiences, the experiences of those that we serve. And she tells quite a moving story and she helps us think. But the whole of this online learning had started before the pandemic and was face-to-face. And Tracy was part of a group of people who co-created a learning opportunity for carers to come together and share with interprofessional groups of students what it means to be a carer. And in co-creating this learning, a group of service users came together in a workshop and brainstormed what it was they wanted students to understand. And in the paper, you can find the questions that they created, and they are very deep, very challenging, and certainly far beyond what any of us as academics could have thought about. I certainly cannot say I understand Tracy's pathway and all the things she has gone through. So those lists of questions brought interprofessional groups of students together before the pandemic to meet in a classroom space, or sometimes in a classroom near to a clinical area, in fact. And during the pandemic, we simply lifted this work and put it online. So the groups of carers came to talk to our students in an online circumstance. And in fact, we deeply worried about whether or not we would gain the same type of engagement in this platform as we had done face-to-face. Tracy actually laments in the paper that she does prefer, and she still prefers, being face-to-face. But if you look at the student evaluations, and we have put a slide in the paper of what the students gained from coming into this space, we created blank slides for students to write on and to share their feelings. And they are incredibly moving and incredibly powerful. And I continue to receive the outcome of this workshop even now on a 2-monthly basis, because we've stayed online, because many of these service users are still feeling very vulnerable and don't want to come into our large universities or places to speak. But these outcomes from students have been incredibly moving. So our take-home messages from the paper are that there are still very few theories for us to be using for co-design in how we set up and design interprofessional education, working in partnership with service users, here with mothers, but we need to bear them in mind. You can't do this easily without having built safe and supportive partnerships, and therefore it mattered that we had got to know one another in a real face-to-face relationship before we went online. Involving service users in all elements of the learning is important, so they stay for the student reflection and they give feedback. We mustn't just have them as people that turn up and tell their stories. They should be far more involved than that. And also, we need to do this in a way that service users feel valued. So we have got resources to pay time for coming to teach, and we hope to have a supportive network, and we offer a community of practice where these mothers and other service users and carers can come. So I hope you enjoy reading the paper. Certainly Tracy isn't here today. It would have been nice if she could have shared her thinking, but this was an opportunity for us to write in partnership with the mother, and thank you to all those that were authors. And I move on now for you to hear from Vicky.
Hi Liz, thanks very much. So where we're at currently in terms of the publication of all of the journals that we've published in the British Journal of Midwifery is we now have the task as a large writing group to come together and to reflect on all of the experiences that we shared, all of the papers that we produced, and we've now got to start making sense of that with an eye on the future. So this final paper, which is under production at the moment, takes all the key learning points from the series where we've explored experiences from students, from academics, from users of services, and also when we've thought about the impact on practice learning and also on assessment. And when we started off the journey, we had 16 authors on the first paper. By the time we got to paper 7, we actually had 22, which just shows you that snowball effect as people come together as part of a community of practice. So we currently have 12 authors contributing to this final paper. And what we're actually going to be doing within that paper is really reflecting on where we are now as we're emerging out of the pandemic. So what are we doing in terms of our IPE provision? What are we retaining? What have we lost? What worked well? What didn't? Really exploring what we did so that it has meaning for the future going forward. So we're really analysing the experiences that we had as a group, but also thinking about the wider implications and thinking about not just local or national, but also the international experiences that people had and how we had to so radically change the way that we delivered our interprofessional education at a moment's notice. because of all the constraints that came from lockdown. So aligned to the ethos of the papers to share best practice, now is the time for us to absorb, to consolidate, and to move forward. So in terms of learning and informing post-pandemic IPE, we're going to be exploring how important it is to co-create our education, working with students, practice partners, working with users of service, and also making sure that we all come together as a collective group. We're also going to be exploring pedagogical advancements and looking at theory that underpins practice going forward. We can also reevaluate how we assess practice-based learning and also how we provide IPE within practice environments. And there's also the opportunity to think about policy, about practice, and about our professional statutory regulatory bodies as well, in terms of the requirements for registration, but also thinking about what it means to be a practice collaborative ready practitioner. And then the other thing that the paper can do as well is to think about research, evaluation, and evidence-informed practice. So the whole ethos of this final paper is to consolidate all the experiences we've shared, to take the richness of the data and the case studies that we use to really highlight the key points, but with an eye on the future, moving forward. Now, one of the exciting things I think that we would all agree was how we very organically came together as a group under the umbrella of the subgroup research working group as part of CAIPE. And it's my pleasure to hand over to Mike now, who's going to talk a little bit more about the process of us collaborating and writing together. So over to you, Mike.
Thank you, everyone. So at the end of the co-writing process in this series, it is important that we walk the talk when it comes to reflective practice. I think we've mentioned that in one of our papers, and we want to really practice that. After a year of working together, we were able to produce the following reflections. First is we reflected that there is a need to exploit the use of technology in order for us to collaborate with people within and beyond the UK who are also situated in different time zones, work settings, and priorities. It is important to note that some authors are also working mothers, clinicians, graduate students, etc. And this entailed for us to be flexible with how we work, and thanks to technology, because it allowed us to have various options to work together online, offline, or both. Secondly, when you read through our papers from 1 to 7, the Article 8 is upcoming. It is important to note that they were written with a systematic approach in mind. However, we reflected that while empirical studies are important, this series focused on translating lived experiences of students, educators, researchers, clinicians, and service users into evidence to be shared and communicated for IPECP practitioners. And lastly, we reflected that the process was not a walk in the park. We were writing these papers amidst the pandemic, situated in various transitions, personally and professionally. But the process taught us that we did not just collaborate for the sake of collaboration, but we did not forget to be sensitive and considerate with one another in times of crises and celebration.
Thanks, Mike. And following on from what Mike has said, we'd just like to thank everybody from the research subgroup who contributed to this series, service users, clinicians and academic colleagues who contributed to the case studies. Without them, we had nothing to reflect on. The whole series is in the British Journal of Midwifery, and all the references are on the final slide. You can find out more about CAIPE on our website, and we'd love you to visit that. It's been recently refurbed by Susie, who's in the room today. So please do go and check out the website. And the presentations will be on the ip.global webpage. So we've talked for quite a long time, so we'd now like to open the floor if there are any questions. We've just put this one trigger in your experience, both as an academic and as a student or service user. How did the move to delivering IPE using emergency remote teaching impact on the following in your experiences? So just an opportunity to share experiences. So yeah, over to you. Just pop your mic on and talk, or if you want to put any questions in the chat.
I wonder if it might be a nice idea for the audience to introduce themselves in the chat, and so we actually see who we have in the room. That might be a really nice segue into exploring your experiences. Hi, Susie.
Hi. I just had a question really about like how you planned all of this out. And I don't know if maybe I just missed that when you're talking about it. Had you pre-planned all of the articles then from 1 to 8, like at the beginning, and said, okay, this is coming out then, or did it just kind of was who's ready to do one first, and then how...
I think the word organic comes to mind. Chaos maybe comes to mind as well. We started off by, I think we were going to do one article, and it was when the group sort of first came together, and it was a really special moment actually, because this has really made us feel like a real community of practice. But yeah, it started as one, and then when we started discussing what we might like to talk about, we realized, no, this is turning into a book, let alone one journal article. So it sort of snowballed. I don't know what others think.
It definitely snowballed. It definitely snowballed in true collaborative interprofessional fashion. And I think what we very quickly realised was the extensiveness of the impact of the pandemic on IPE, and how many different areas of not just education but practice had been touched by this. And when we became mindful, when we realised that, when we became aware of how many different facets were affected, then we realised that we needed to pick up on these perspectives through a series of papers, and that's how 1 became 8.
It was also very much, I suppose I just found it great. People kind of just put their hands up and really wanted to align with their areas of interest and expertise. I don't think we really kind of struggled to get authors for any of the articles either. There was kind of lots of kind of co-writing, lots of sharing of practice. I thought it was really heartening actually to see, especially during that kind of really, really difficult period, that people were still willing to kind of work together and actually make the most of what was a really, really challenging time. And so it was definitely very much organic. I don't think we really struggled to get kind of lead authors or kind of a writing team for each paper.
Any other questions or comments really? We've had one person introduce themselves, but unfortunately they've had to leave. But I wonder if anybody else in the room wants to introduce themselves and sort of share why they're here. We're delighted you're here, but tell us a bit more about you. We could just talk about CAIPE all day. We'd happily talk about CAIPE all day.
Lisa, I wonder if I could put you on the spot. I don't know if you're able to come in at this point, but you've been a really integral team member all the way through this series, and just completing your PhD. You joined the group as a PhD candidate, as a student. So I just perhaps wondered if now would be a good time to come in from that point and explain how you got involved with CAIPE and what your experience has been.
Yeah, no, happily share my experiences. So yeah, as Vicky said, I started as a student from the University in St Andrews in Scotland. I was introduced to the CAIPE group by my supervisor, Veronica O'Carroll, and yeah, I was kind of thrown into the cold water, so to speak. Like I joined the group and then joined the subgroup, and it was just fantastic. So my PhD was slightly related to IP. It was about curriculum development and telehealth. But yeah, CAIPE definitely brought so much like insights and so much expertise into my PhD. That was just really, really lovely and really fantastic and great group. So if anyone wants to, I'm just advertising CAIPE now. If anyone wants to join, it's definitely a really good group, really, really productive, really really good outcomes, really good output.
I think just to add to that, there's something about co-creating through writing together, which is really very collaborative. And it's hard to do papers with few people, but so much easier when a group of people come together. So for anyone in the call who would like to get involved in things like this, finding people to do scoping reviews with or systematic reviews together is a really good thing to do. And it's quite a bonding thing to do, I think, in terms of understanding collaboration and how much better it can be when you've got more heads than one or two or three.
I've just seen in the chat, hi Angelica from Northampton, yay. So somebody read my email, that's really reassuring, Angelica. I'm delighted you're here, delighted you're here. So thank you for coming and thank you for reading it. And I've just put the CAIPE website up. I think you can see that on your screen now, everybody. That's our new. Well done, Susie. So if there are no more questions, Tony, should we hand back to you?
Hand back to me. Sounds good. I think what you all have accomplished has been an amazing feat. You know, to be able to do this across time zones, across the world, and develop such a rich series regarding this these transitions IPE has made during COVID. So kudos to you all. You know, you're all fantastic colleagues, and you gave a great presentation today. Thank you very much. This video will be available at that same link that I posted on the website as soon as we get it processed. But well done, everyone. Well done.